Hi, Dr.
Hi,
David.
Diana. How are you?
Good. Everything
All
is
right.
pretty good.
So it's a lovely, is it Saturday morning? It's Saturday morning.
Yes.
And we are recording this during, still in our COVID mode of doing Zoom presentations because of COVID. So just to give patients a reference, depending on when they're watching this. So we are just after Thanksgiving in 2020. And so we thought we'd make this video that would help help patients decide which is a good choice for them, you know, restoring their teeth with Bioclear method or using porcelain. So first, a little bit about myself and about Diana. So Diana is a registered dental hygienist that works for Carroll Dentistry. And she is a trained dentist and she is licensed in Spain and in Venezuela. And she is being trained right now to eventually have her license in the US as well. And so she is familiar with conventional bonding and Bioclear. And so for the patients who don't know what Bioclear is, we're going to recommend that you go to a video on YouTube called The Bioclear Difference, which is a video that is on our Bioclear Miami channel. And that is like a 7-minute video that will kind of help explain the difference between what is Bioclear and what is conventional dental bonding, okay? Because Bioclear is a form of composite bonding, but it is quite different than conventional bonding that most dentists were taught. And Bioclear is a relatively new method of doing composite bonding. So it is kind of taking storm in dentistry right now and is becoming very popular. And so, and even companies as influential as 3M are now involved with Bioclear. So we are going to go over that. So let's go into it a little bit and get you started on learning the difference so that you as a patient can make a more informed decision. Oh, and who am I? I am David Carroll. So I am that goes kind of with our disclaimer that we come up with right here. I am a Bioclear instructor, and I am also a field tester for 3M materials. So, but I certainly do lots of porcelain-based dentistry, and I think, Diana, we took impressions on at least 2 or 3 porcelain cases last week.
Yeah.
So it's not like we only do Bioclear. So we're very open to whatever is best for the patient in that particular situation. So this is an example of a large porcelain case that my father did years ago. And you can see one of the things that might make this a better porcelain case than a Bioclear case is that it's a lot of dentistry. So when we talk about Bioclear, we're talking about dentistry that the dentist is actually doing by hand directly in your mouth. When we talk about porcelain, we're talking about restorations that a dental technician fabricates in a laboratory. And that technician will have impressions that are made either with one method or another, but the technician has days or maybe weeks, often several weeks, available to create these beautiful restorations. So if you're looking at maybe an entire smile makeover, there's a better chance that you're a better porcelain patient than a Bioclear patient. Because for the Bioclear dentist, it's just going to be, unless the Bioclear dentist is highly, highly, highly trained and highly motivated, then it's going to be maybe too much work to do with Bioclear method. Here's another porcelain type restoration. And this is another indication if you're a patient that might be more of a porcelain type patient. When you have teeth that have dark roots and dark discolorations in them, and it's going to be hard to mask the color and make things match, that is probably better handled off by a technician because the technician has time and many different methods for masking teeth that are dark or discolored teeth, or if you have a mixture of teeth and implants in the front of your mouth, or a case that just becomes much more complicated, okay? So that might be another indication for porcelain versus Bioclear. And porcelain can last a long time. So one of the benefits of porcelain that we know of is it's been tested and we have a lot of long-term follow-up. However, I think, Diana, you would see on the bottom picture, 12
Yes.
years later, can you see the margins on those porcelain veneers?
Yes, I see a little bit of recession of the gums, and now you're showing the little yellow line on the margin.
Right, right.
Yeah.
So even though porcelain, the material itself, is long lasting and can be stain resistant, we know that gums can move and things can change. And so nothing is forever. So even if you're doing whichever method you choose, there's going to be a time where the patient's probably going to want to replace that work.
Correct, yeah.
Mm-hmm. So, and porcelain also has some concerns that go with it, such as it has an abrasive quality to natural teeth. So this is a patient whose the porcelain crowns on the upper were done a long time ago by another office, and they look like they're done nicely. However, nothing was done on the bottom teeth, and the patient didn't pursue any treatment there. And so the porcelain restorations on the top have abraded the lower teeth away and made it very difficult to restore those teeth. So we did porcelain restorations on the lower teeth to compensate. And this is actually 5 years later, when the porcelain restorations have been there for 5 years. And you can see where they've picked up some staining around the edges, but they generally look pretty good. Now, what did we have to do to get those porcelain restorations to go into the mouth? We had to prepare the teeth for porcelain. And this brings up one of the big differences between porcelain and Bioclear.
Dr. David, I'm sorry. So these days you will choose a different treatment than veneers for that specific case, or
that's a good question. I think in this patient's case, I probably would still do the porcelain restorations on the bottom. In my hands, I would probably still do the porcelain on the bottom for that particular case. But again, it does have to bring into the account that the patient has to be okay with preparing teeth for crowns. And I think you and I would agree that most crown preparations look something like what I'm showing right now.
Yes.
More or less, okay? Now, veneer preparations for porcelain veneers can be a lot more conservative, and we can talk about when you can do conservative porcelain versus when the preparations have to be more aggressive in order to make space for the porcelain. So in this situation, I had to do what I felt was retentive restorations that had to have more like a crown type preparation. So these are like either full crown or 3/4 crown, and a couple of them are prepared for basically veneers, but most of them are like crown preps. So that is often one of the distinctions for patients about what they are willing to do is, are patients willing to have their teeth prepared for porcelain, or are they against having their teeth prepared? So this patient came from an orthodontist and has completed ortho and doesn't not want their teeth cut at all, but they want to close those spaces and they don't like the shape of their teeth. So this is how Bioclear works. Bioclear is a method of surrounding a tooth in basically what we call the aquarium, and we are going to inject warmed composite material into that mold and create a new tooth shape. So of course, now you look at these teeth compared to the last set. So these teeth have not been cut down. These are exactly the teeth that were there. All that's happened is we have thoroughly cleaned the teeth to get them ready for that procedure. That's it. So we haven't cut the teeth. So that means the teeth are going to have to get larger in the restoration in the product. So there we go. They, as you see, they've grown in size. Okay. But if we look at the before and after, it's pretty complimentary for that patient, right? And we did not have to cut the teeth. So this is the magic of Bioclear, is the magic of being able to close spaces, like we have a black triangle here. The magic of being able to close those triangles, close spaces, overmold teeth, rejuvenate teeth without cutting teeth away. So if we were going to do porcelain restorations on these teeth, we would have to at least do some preparation, and to close the triangle, the black triangle in the center there, we're going to have to get somewhat aggressive with our preparations to get the porcelain to work. And we can go into, I think it's beyond this, the discussion of why you have to cut teeth, but basically patients need to understand that the porcelain needs to have a path of insertion. It needs to have a way to go in. And so a technician can't just wrap it around the corner the way we can with those molds. With those molds, we can surround a tooth and inject material around a corner without having a shape that allows porcelain to just drop in.
Correct. So, Dr. David, as a patient, how do I know if I'm a good patient for Bioclear or porcelain? There is a specific case that you would say you're a Bioclear patient, or there is a specific case that you're a porcelain patient. How do I know? How can I decide which is the best way for me to go?
Yeah, so this gets complicated, of course, but the first thing you would ask yourself as a patient is, are you comfortable having the teeth prepared or shaved down in some manner? Now, if you have no spaces between your teeth and you don't see any black spaces, you don't see any black triangles, you don't see any gaps between your teeth, and your teeth are all lined up relatively nicely, but your teeth are just small or undersized, that might be a case where you can do porcelain as a minimal prep, or maybe even a no prep. On the other hand, if you see spaces, black triangles, gaps between your teeth and stuff like that, then you can probably assume that the teeth are going to have to be cut and cut down in size for porcelain. So that's the first thing as a patient is, am I okay with having my teeth cut, or am I opposed to it? Because some patients are adamantly against having teeth cut down. So that could be a deciding factor right there.
And another factor after the restorations, the size of the teeth. Like sometimes for some patients, they could look too big or too bulky, or that could be another factor.
Totally, because we know, so if you're going to have your teeth rejuvenated with this Bioclear technique and you're not cutting anything off of your own teeth, then you know the teeth are going to be larger. So then you have to decide, are you okay with larger teeth? Or is there a way the dentist can show me more or less how large are they going to get? Which there are ways to do that. There are ways to do what we call a mock-up. And we do that with porcelain and Bioclear to kind of give a preview of how big are they going to get if nothing is cut off the teeth. Now, if the patient comes to us and they say, you know what, it doesn't matter because you're not cutting my teeth, then sometimes we might go forward with a relatively minor procedure like this one. We did not do a mock-up on this procedure because the patient says, you're not cutting my teeth, I just finished orthodontics and I'm not straightening my teeth so you can cut them down. So in that case, we just went forward with this one without a mock-up. But for a lot of patients, you might want to see some kind of preview of some kind. How big are they going to get?
Got it. Dr. Ivy, one more question.
Sure.
As a prosthodontist, you see any difference in the margins between porcelain and Bioclear, the gingival margin? You see, when you're as a hygienist, you like everything smooth. So you see any difference? You feel any difference between one and another?
Well, that's one of the amazing things about Bioclear. I think that if the Bioclear dentist is pretty far along in their training and they're progressing, and we'll talk about how far along a Bioclear dentist is and how advanced they are, I think the ability to get what we call the margin or the interface where the material meets the tooth, I think if anything, the Bioclear margins are better, more seamless. They tend to not show up so much. They tend to be more invisible. No matter how good the porcelain is, I think I would give the advantage to Bioclear on the margin part. So now, whether that margin is going to pick up stain 5, 8, 10 years down the road, that's another discussion, because the porcelain margins, as we've seen, no matter how good porcelain is, it can pick up stain too. And the Bioclear margin is much easier to refinish and repolish, whereas a porcelain margin is hard to cure that staining situation. So I would probably, on the margin issue, which is what you're talking about here, I would give the edge to Bioclear on the margin issue. Yeah.
So, talking about the same subject, which one is, in your opinion, is longer lasting, and which one is easier to repair?
Okay, so these are great questions, Diana. These are great questions. So, and I think these are questions that patients really need to think about. So on the lasting issue, I would probably still give the edge to porcelain right now, just because we have such a long track record with porcelain in dentistry, and Bioclear is relatively new. However, I have seen, I've seen pictures of Bioclear cases now that are 10 years old, and they look very nice. So I still would give the edge on the longevity to porcelain, because as you know, we have quite a number of patients who have porcelain cases that are more than 10 years old, some of them more than 15 years old. We even have porcelain patients who have work that's more than 20 years old. So, I would give the edge to porcelain on that one. As far as easy repair, Bioclear is easier to repair, for sure. I mean, there's no doubt that it's not easy to repair porcelain. If porcelain breaks or something happens, you need to cut it off and make a new one for the most part. You can do minor repairs on porcelain, but it's very difficult to get longevity out of those repairs.
Got it. Thank you.
Yeah. So this is another example of, a really nice Bioclear patient who is easy Bioclear case, where we basically take out the discolored restorations, the filling material that is discolored. She doesn't like this black triangle, and we can sort of seamlessly fill in with Bioclear and make it disappear, again, without cutting away any part of the healthy tooth. No preparation to the healthy tooth required. A frontal view on the same patient. Very easy, small case. That's a Bioclear case 100% to me. That's not a porcelain case. That's
how many teeth did you treat with a?
Just 3. Actually, wow. Only 3 teeth. Only 3 teeth were done in that case. And honestly, I don't think it would be hard to get a result as good or better than this with porcelain. And again, we would have to cut the teeth. And this patient actually was opposed to cutting teeth, because this is another case actually that I had proposed porcelain many, many years before I had Bioclear training. So for those of you, watching this, I've been Bioclear trained for about 4 years now. And really only the majority of the Bioclear I've been doing is in the last 3 years. And so this patient had been a long-term patient in our practice. I had proposed porcelain many times, and she had said, well, you're gonna have to shave my teeth. And I said, yes. And she said, no, I'm not doing it. So when I explained to her the new method with Bioclear and I didn't have to cut her teeth, I was just gonna take out the discolored restorations and then rejuvenate the tooth without cutting the healthy tooth. She said, fine, let's do it. So we have a lot of patients like that are opposed to tooth preparation. And a lot of these patients are familiar with crowns because they have crowns in the part of their mouth. So if you're a patient and you've already had crowns in your mouth, you know what that's like. So you know that basically in a crown preparation, you're going to reduce about 50 to 70% of the volume of the tooth, depending on where the tooth is in your mouth, in order to make room for the technician to make a crown. It's a lot of reduction. So this patient actually came to us, as you remember, Diana, that this patient had been to several dentists and refused, and every dentist told her that in order to improve her smile, they were going to do porcelain. They were all going to have to cut the teeth. And she has a lot of existing bonding on her teeth, and she was adamantly against having her teeth cut for porcelain. So, it's subsequently, I showed this case in a meeting, in a Bioclear Summit meeting, and I asked the dentists in that meeting, who were all familiar with both Bioclear and porcelain, I said to the dentist, I said, how many of you would say that this is a minimal prep or a no prep porcelain case? And none of them said it was minimal prep. None of them. They all agreed that since her teeth are large and prominent already, that in order to do porcelain, we would have to cut for sure, that she's going to require tooth preparation. And she's actually going to require quite a bit of preparation in order to get this ready for porcelain. And she told all the dentists, no way. That's how she found us. She found us because she was looking for a no prep alternative. Now she's going to have to understand that since her teeth are large, if we're going to do no prep, guess what's going to happen?
Her own color is going to show through, right?
Right. Or the teeth are going to get bigger. You know, they're going to have to she's going to have to be comfortable with the teeth getting larger, quite a bit larger, in order to be a no prep case. So she insisted, and we went forward with Bioclear, and there we are, wrapped with our nice little shells around our teeth. And you can see actually she had a gap between her two front teeth. After I took the old bonding off, there is actually what we call a diastema. And so this is after we finished the initial wrapping and the initial carve back, and the teeth are looking pretty big. And then we trim back a little bit more, and she actually really likes it. And she likes this new look, and it made her look a lot more youthful and a lot younger. And she was actually able to pull off the bigger teeth thing. She was actually able to get away with it and pull it off. And so, you know, in the end, she was right. She was right. She knew something about her own face, and she knew that she didn't want her teeth cut. And so it worked out very nicely in her case.
Looks very nice. Yes. So in this case, or some cases, it can change the facial features. It can enhance the lips when, you know, because now we're making the teeth look bigger. So that can make any difference in your lips or your face.
Yes. And women are often interested in fuller lips, or, you know, the side effect of doing larger teeth, having fuller lips. And it can, and I would give, you know, it can do that both with porcelain and with Bioclear, but I would give Bioclear the edge on this one, because with Bioclear, you have that ability to build very large and slowly cut back, so that a patient can discover how much volume they can tolerate. And so in that case that we just showed, she really loved the facial change actually more than the teeth even. She likes the teeth, but she really likes what happened to her face. So I think Bioclear has an edge there because of that ability to adjust. You know, we can build large and slowly cut back. By the way, it's also important for patients to know that both of these methods, both porcelain and Bioclear, are not reversible. So that's a question we get. The patients want to know, can I reverse it? Can I take, no, neither one is reversible. Not porcelain. You have to cut off porcelain. It's a big job. You have to cut off Bioclear. It's a big job. So, so both of them are a commitment. So even though, yes, Bioclear may be less invasive, we don't have to cut the teeth very commonly. Some cases we might trim the teeth a little bit for Bioclear, but some cases we don't have to, but it's still a non-reversible procedure. So this is an example of like an ideal Bioclear patient, because this patient happens to be a hygienist, and hygienists are often very conservative and don't want their teeth cut. So there's very few hygienists that want to have their teeth cut down. So she had black triangles and her teeth are beautiful teeth. So all we did was a combination of tooth whitening and Bioclear to fill the spaces. And so this is a 100% Bioclear patient. So and this is one of the reasons why we do so much Bioclear in our office, is because there's so many patients that are indicated for it. And really, in my opinion, not indicated. This is not a porcelain patient, not at all. Because if you're going to do porcelain on these teeth, you have to cut a lot, and there's nothing wrong with her teeth. She doesn't even have any restoration. She doesn't have not even a filling. They're perfectly virgin teeth. So another case for Bioclear, very simple black triangle closure, very good teeth, very easily handled with Bioclear. Another case similar, we get a lot of these referred to us from orthodontists that have finished ortho, but there's spaces left over. Perfect Bioclear patient, perfect Bioclear patient. Another perfect Bioclear patient, very young girl, does not want teeth cut, and the orthodontist does not want her to have her teeth cut either. And she's finished with orthodontics, but she still needs her spaces closed. So Bioclear is the perfect solution for that. So now, on the other hand, let's bring this case back, okay? We see all the things on this case that make it, in my opinion, a porcelain case, okay? There's no way that I'm gonna do that at my skill level, and I feel like I'm fairly trained at Bioclear at this point. But I'm not gonna tackle redoing those crowns, trying to, redo those crowns as Bioclear crowns. Now patients ask, is there a way that you can make a crown out of Bioclear? Yes, we can create a Bioclear crown. In some cases, not in every case, in some cases, but this is not the place for it. And you can see all the things going on here. Too many colors, too many black margins, black edges. And we got help from a very talented periodontist who helped lower the gum tissue on those teeth. So, and we have a 10-year recall that shows that we made a good choice, right? So now this is one that could go either way. This is undersized teeth. We could have done Bioclear here, but in this case, this was before I was Bioclear trained, so it was all porcelain back then. We were able to do minimal prep porcelain now. So how do we know we can get minimal prep porcelain? Like the things we talked about before. We talked about that the teeth are undersized, but there's no gaps, no spaces. We could say that there's gaps at the edges, but those gaps are easy to handle, okay? There's virtually no big triangles, no black spaces, no big spaces between the teeth. So that makes for a good minimal prep porcelain case. Now, how about this one, Diana? Would you do this would you have done this as Bioclear today, or do you think you would go porcelain on this case?
I think either or. Bioclear would have been great for her because her natural color is pretty. You can just add material and the color is going to be nice. They won't be too bulky. I think Bioclear would be pretty much a good option for that case if I have the training.
Yes. Yes, and we're going to talk about training because you're bringing it up, and we're going to talk about, and I want the patients to hang on to the end of this video because that's an important part, is what is the training level that the dentist has gone through with Bioclear, and so and how do they find a dentist who's trained in Bioclear? That's the first thing, because unless the dentist has experience in Bioclear and porcelain, both, then this discussion is this is a discussion in nothingness, right? Unless we have training in both modalities, then we know we're doing porcelain, or the dentist might have a lot of experience in conventional composite dentistry, but Bioclear is not really an option. And Bioclear opens up a whole different world of options for dentists because of the ability to wrap those teeth like we showed with those nice little aquariums.
Yes.
So this was done with porcelain, minimal prep. and done with a very, talented technician. So it looks very natural, very beautiful. And the technician can do little things like little characteristics and put little incisal edge translucencies and little things that make it come to life. So I would give the cosmetic edge, I would give that to porcelain in many situations. Not all. There's a lot of situations where Bioclear will get an edge, like we talked about, that margin, that interface. So if you know that you're a patient and you've had trouble with gum recession and the gums keep moving on your smile, okay, then I think you're a better Bioclear patient.
Dr. David, I have one question. If I'm the type of patient that I want a very natural look, I want something that it looks really natural, really like even like I like the color of my teeth. So what do you think in that case? It would be good for porcelain, would be good for Bioclear?
Well, we did show a few cases already where we had Bioclear looking extremely natural, but I would probably say, and I would say if the case is very small and your own teeth have a nice color to them, and you don't have too many restorations in your teeth already, and nothing's really dark or nothing's really looking, then I could go Bioclear on that case. On the other hand, if you're a patient like this, and we're going to do basically like a whole smile, and you're looking for that really kind of that exquisite, natural, then I would probably lean towards porcelain. But now a lot of patients know friends who have had porcelain work and it looks fake, right? So
yes.
we've seen plenty of that. So again, the patient, just because the patient's going to do porcelain doesn't mean they got to do their research too. So I would want to see, if I'm a patient, I would want to see from the dentist pictures of cases they've done already with porcelain.
Mm-hmm.
I want to see what they consider their best porcelain work, and I want to see what that looks like. I want to see if that's natural enough for me, or not. Yeah. And I would also want to see their Bioclear work too. I'd like to see some of it to kind of get an idea of what that looks like. Does that look natural to me or not? So I think they have to kind of judge that. So yeah, this is beautiful porcelain work, and technicians can be very talented, and they've got, like we talked about, they have weeks, okay? They have weeks to sit down at a lab bench and really do exquisite work. So now, on the other hand, this is a Bioclear case. I would say that's fairly natural looking.
Yeah, it is.
Right? And this patient was done in one visit, no cutting of healthy tooth. So again, it depends, it really depends on the patient and the situation. So, and now this kind of patient, we just had on our Instagram account, we just showed a 4.5-year recall on this patient, done with composite, done with Bioclear technique on the lower, and the upper was done in a different composite technique before I was Bioclear trained. But this patient was actually waiting for Bioclear because the patient was very young and the patient's mother insisted on no cutting of teeth. So to do porcelain on a patient like this, you have to heavily prepare teeth. And this patient at the time was in their early 20s or younger, maybe 19 or 20 years old. So I would call this an advanced Bioclear case, because as we're seeing this, we're doing a lot of teeth. So we talked about Bioclear is easier if you're doing fewer teeth. This is an advanced Bioclear case, but capable of being done as a no prep, as a no cut. And in this case, I would do the same thing again. I would do Bioclear upper and lower today on this patient 100% of the time. This is not, to me, this is not a porcelain case, because the preparations are going to have to be too aggressive to get porcelain in on this patient. So this case would be 100% Bioclear today. So that was her before and her after. And we're going to see her 5-year recall coming up, but she's at 4.5 years. She looks perfect. So I'm not expecting much to change in the next year or two. I think she's going to go probably to 10-year mark before we have to rework the case a little bit. Now, what does that mean for patients that are doing Bioclear? What does it mean to rework the case? It doesn't mean we're going to take all this composite off. It means that we would probably repolish, refinish. We might re-overmold a couple teeth and rejuvenate it again. But I would expect that there's going to be some maintenance. There's going to be some maintenance at that mark, at that, somewhere around that 8 to 10 year mark for most of the Bioclear. Most of the porcelain cases, because we cannot really rejuvenate them easily, for porcelain, I'm really looking at more of a 12 to 15 year run if I can get it. If the gums don't move too much, not too much recession, not too much staining, I would like to go 12 to 15 years before a replacement event, okay? And this is another Bioclear case. Again, a patient that was not in the mood to have their teeth cut. And I think we did 1 implant crown back here. So natural, and we sometimes blend porcelain and Bioclear depending on the situation. That's another discussion, but sometimes we'll do Bioclear with porcelain in the same patient, sometimes on the same arch, because we want to conserve tooth structure where the teeth are healthy and other teeth are not healthy. So we're doing, if the tooth is too broken down and is too far broken down, then porcelain is often a better option if the tooth is too far gone. So another indication there. So that sort of wraps up, the slideshow. And any other questions that did we leave out any questions that you thought of, Diana, that a patient would want to know?
Well, one question, it's about the price. What is the difference between porcelain and Bioclear? Because that's it's a very important point for some patients to, if they have the resources or not, to do one or another.
Right.
And also for the future, what it means to do porcelain and what it means to do Bioclear. Like if I have to repair or I have to do something to the Bioclear tooth in a few years, what is going to cost, not how much is going to cost me, but how much is going to be involved?
Okay, so that's a great question. And let's talk about fee structure. So generally in our office, our fee structure is Bioclear is about somewhere between 75 to 85% the fee of porcelain. So there's not a big money difference in the upfront cost on a per tooth basis. Okay. Now, having said that, okay, it's very common that we do Bioclear cases at lower cost than a porcelain case would be, because we're very commonly doing Bioclear as sort of a smile makeover, but in reality, we're only doing a few teeth. We're doing tooth whitening, which is inexpensive. We're doing maybe a little bit of orthodontics, which is relatively inexpensive. And then we're doing Bioclear, and we might only do a few teeth. So there's a lot of patients out there that want to rejuvenate that smile. They want to look a lot better. Or this, you've seen, Diana and I just worked on a case last week or a couple weeks before on a gentleman who we had to Bioclear the whole top, and we're going to do the lower now because he's adamant about not cutting his teeth, and he doesn't care about cosmetics. What he cares about is his teeth are so sensitive he can't hardly drink water, and it hurts to breathe air through his mouth, and he's tired of trapping all his food between his teeth. So now in his case, the fee structure would have been basically the same. I mean, I would have charged as much for porcelain as I did for Bioclear, but he's a Bioclear patient because of his criteria of he doesn't want his teeth cut down. So fee structure, I think on a per tooth basis, you can expect it to be somewhere in that range. Maybe it's going to be a little less than porcelain, 10 or 15, 20% less than porcelain fees on a dentist. Maybe not. It could be more complicated to do Bioclear because some patients have so much existing bonding on their teeth. They want all that bonding taken off first, which is a time, you know, it could be hours of carefully removing the old stuff to preserve the tooth without hurting the tooth before putting the Bioclear on. So I think it's going to depend on, you know, every patient's situation is different, but some patients are good candidates because they can do that whole kind of that smile makeover that we keep doing for so many people. We keep doing these smile makeovers and we look at it at the end and we say, well, what was it? It was 2 or 3 teeth, it was 4 teeth, it was some whitening, and it was a little bit of this, a little bit of that, but it wasn't $15,000. It was maybe it was 4,000 or 5,000 or 6,000. It wasn't a $20,000, $15,000 case. And yet the patient got this whole new look.
Mm-hmm.
So yeah, so I give Bioclear, since we're kind of keeping the scorecard of what is better, Bioclear or porcelain, I give Bioclear the edge on that. I definitely give Bioclear the edge on lower fee smile rejuvenation. Oh yeah, for sure. Yeah. So I think we covered pretty much, I think we covered a lot of it in this discussion. And I think we talked about if the patient still wants to know about the difference between Bioclear and conventional bonding, they can watch that video on YouTube called The Bioclear Difference, which is a little short video we made. And now, what I promised the patient is, how do you find a Bioclear dentist? Mm-hmm. Okay, that's another thing. So this is on your mobile phone. You can just bring up this site, bioclearmatrix.com. When you bring up that site, you will see enter your zip code. You can put within 50 miles, within 100 miles of you, or whatever you want. I put anywhere on this one. So when I punched that in, it brought up a couple of my friends in Atlanta, and it'll show you your distance. See if I want to go see them for my Bioclear. If I need Bioclear on my mouth and I'm going to go to Atlanta, it's 600 miles. Which patients will do. They will do it.
Yes.
To get that. We have seen patients driving a long way to get to us. So yes. That's how it works. Just use this bioclearmatrix.com, use that site. If you have any questions for Diana and I, we can both be reached on Instagram by messaging us, and those are our contact information on Instagram. We're located in Miami Beach, and we're more than happy. I mean, we get questions from, it's amazing how social media has changed. I get questions from dentists asking me Bioclear technique questions from Egypt, Saudi Arabia. I mean, it's really phenomenal the way that we communicate now. So feel free to message Diane and I, and we can try to steer you or answer any questions that you might still have.
For sure.
Yeah. So I think anything else? Did we miss anything, Dee?
I don't think so. I think we covered pretty much everything that the most common questions. I think we did a pretty good job.
Yeah, not bad. Okay.
Yeah.
All right. Well, thank you so much. Thank you for tuning in and watching this video, and we wish you all the best.
Thank you.
Bye.
Bye.